Good morning. My name is Elijah Charles Kinyage. Catch us live at Metropole TVKE across all your social media platforms, and I'm at Kinyage Simba. This is your official sector trends this morning. Now let's get into it. Now, COVID-19 has led to a lot of innovations being implemented, and it mainly is affecting our health. Technology has had a huge role to play in transforming healthcare nationwide. Thus, information and communication technology solutions are key to helping countries achieve the universal health coverage. Now, helping us look into how technology can speed up universal health coverage, we are joined by Oscar Githinji Nyanga, who is the General Manager at MedBook Kenya. Oscar, good morning, sir.
Good morning.
It's not the very first time that you're into our studios here this morning. I'm going to take this chance again to welcome you, meaning that you and I are beating COVID. That's the only good news.
Gladly okay.
Isn't it? Gladly okay.
Yeah.
Now, for those of us who didn't get to watch you the very first time that we had the conversation about MedBook, can you officially introduce MedBook and tell us what MedBook is into?
MedBook is a health IT company which was formed in the year 2014.
Yes.
Started as a joint venture between Strathmore University and iLab. So we were incubated, and from the onset our idea and what we wanted to do to change the world was to digitize medical records.
Yes.
So for the last 7 years that's what we've been doing, and we have a couple of solutions in the market, telemedicine solutions, hospital management systems and claims management system that are out in the market and have really revolutionized the industry.
Pretty much.
Yeah.
But I'm gonna stick to that just before we come to the gist of the conversation this morning, because when we spoke, we were saying, well, COVID-19 pandemic offers a chance for people to look around and see who's going to give us these solutions that are in better need now, that are going to come in and streamline the health sector in the country. Out of that bouquet of solutions that you're offering, which one would you say has picked properly within the COVID-19 pandemic?
Good. Thank you for that. The last time I was here, we were just relaunching the MedBook Africa app,
yes,
which is now on iOS and Play Store.
Yes.
And it has really done wonders for the industry, because from that app, you can actually go on the app, you're able to search for a doctor.
Yes.
And once you get a doctor, it will give the nearest doctor 3 kilometers from your location, and you're able to either book a visit to go see the doctor at his facility, or you chat with the doctor, book for a chat or a teleconsult. And more to that, now you're able to actually tell the doctor that you're more comfortable for the doctor to come see you at home. So that has reduced a lot of traffic in the hospitals, and also has brought a lot of more revenue for doctors, because as I was telling you last time, our idea was to let doctors concentrate on medicine.
Yes.
And as MedBook now, we are actually getting them their customers.
Yes.
So doctors now are able to be enlisted on the platform, and we are able to give them over 1 million patients who can now go on the app and get access to medical care.
Pretty much. So, but you're talking about how you're looking at pertinent collaborations, because this is not just something that you're going to push by yourself, because it has to touch even the public healthcare sector for people to realize the importance of digitizing these records. Would you give us a progress report, sort of exactly on where you are in those collaborations that you're looking forward to?
Thank you. It has been really good.
Yes.
We've talked to a couple of county governments.
Yes.
And as in this particular country, healthcare being a devolved function, we're now talking to governors, and now we want to roll it in a couple of governments, such that people in the various countries can actually go on the app and can get access to all these doctors. Because one of the things that we found that has been a problem in this particular country has been accessibility. So somebody has an issue, but probably that person thinks that that issue only affects themselves.
Yes.
But if they can go to the app and be able to search, let's say, for a gynecologist, and from that chat with the gynecologist, first of all, there's an assurance that what you're going through is something that can be sorted, and the doctor will now tell you, please come to my facility tomorrow at 9 a.m. and I'll be able to help you out. So this is now going to the community, going to every person in those particular counties and giving them access to top-notch doctors here in Kenya.
Yes.
More to that, we are now branching in other countries in Uganda and Tanzania, so that we can now broaden the scope and the customers that these doctors can be able to get.
Yes. You mentioned something very important, that you've now targeting the counties. Is that where you're starting from? And does it become easier that you actually have now the solution and the healthcare now has been devolved? Can you also give us exactly the reception that you're getting from these counties? Because now counties now have to chart their own way when it comes to health care in these specific areas. Is it easier now for you to target counties as opposed to targeting the general national government when you're looking for these collaborations?
Yes, it has been hard. It has like just like any other business out there.
Yes.
It hasn't been that easy. But at least now, from the mindset that we're now changing mindsets in people.
Yes.
We are now changing the idea that hospitals are brick and mortar. Basically just buildings that people have to go to.
Yes.
So now that if we're able to tell people that the same way you access mobile money on your phone, you can be able to access your medical records. And moving from doctor to doctor, your medical record is now being stored on your phone. And this has really helped basically the patients out there, so that they know that should I go to Dr. A and then I go to Dr. B, I don't have to pay for another radiology, I don't have to pay for another lab test, because Dr. B can actually see what has been my history.
Yes.
And this is what digitizing medical care is all about. At the comfort of your phone, you'll always have your medical records.
Pretty much. So let's talk about the general conversation that everybody is really speaking about in the country right now when it comes to health. We do know it's the universal health care. That's what the government really wants to spend its energy towards. Well, we're going to leave the do's and don'ts and what is working or not working in that bill. But what do you find yourself right now in terms of universal health care, your solution? Do you find yourself right within, or do you find yourself sort of outside where the government wants to push toward?
Okay. First of all, I say we're very lucky.
Yes.
And in the office, we always say that universal healthcare starts at Medbook. Based on our 7 years of experience,
yes,
these are things that we've been talking about. And we're very happy to see government now trying to position itself and also trying to push the universal healthcare.
Yes.
For your viewers, I'll just like to explain to people what universal healthcare is. Now, universal healthcare is the idea that all residents of a particular country can get access to healthcare. And if you go back to our constitution, when you talk at Article 42(1), talks about every person has a right to proper healthcare.
Yes.
And 42(2) talks about every person should get access to emergency healthcare as well. Okay. Now at Medbook, we have the solutions, and one of the things about universal healthcare, you need a company that is able to, first of all, have the data. Okay. Because one of the things about universal healthcare is that you have to build hospitals, you have to provide drugs, you have to provide doctors. Okay. For you to do that, you need to know in which particular county are you going to start.
Yes.
And which particular county needs more drugs, needs more doctors, needs more nurses, and so forth. So currently, when you look at Kenya, the doctor to patient ratio is 1 to 6,000, and the WHO recommends to 1 to 1,000. So for you to beat that, first of all, you need to now deploy ICT in these particular counties, such that instead of Simba going to a hospital and queuing in line, how about we give them the tools that Simba now can actually book an appointment to go see that particular doctor, and Simba can actually get telemedicine as a form of coverage.
Yes.
You see now with ICT, you'll be able to roll out a universal healthcare across the country.
Yes. But so when we look at this universal health care, it looks as if it's a government agenda, it's purely government agenda. Would you confirm that it also gives, I would say, the ease to private players to come in and peg on this universal health care, I don't know, push? Does it give you that ability, or is just left for the government?
Just like any other business, government's work should always to provide a conducive environment for private sectors to play in.
Yes.
Come up with the policies and come up with the strategies. But it's the private sector to now push all these particular agendas. It is private sector who can actually has the muscle to actually complement what the government is doing.
Yes.
So it's a public-private partnership whereby government can tell you that we want to roll out a new cancer, we want to build more cancer hospitals in, let's say, Isiolo. But now you need the private sector to come in and boost what the government is doing. So from the government point of view, the government can now create policies, can reduce the bureaucratic red tape, and now private sector can come in and actually do the business.
Pretty much. Now, let's really talk about why you see yourself really coming in handy. I mean, yes, we do know that our healthcare system is lacking in one way or another, but when you look into this universal healthcare, which place would you say this is where we have rightly fit 100% as a MedBook?
Data. Data.
Yes.
First of all our solutions are on the cloud.
Yes.
So that means that deployment across any county, any of the 47 counties in Kenya is at a click of a button.
Yes.
Why I keep insisting on the data is that before you roll out any brick and mortar hospital, you need to know what is the biggest need of the residents of that particular county.
Yes.
So I'll take you back. December 2018, the government rolls out the trial phase for universal healthcare. And the 4 counties that were picked were Isiolo, Machakos, Nyeri, and Kisumu.
Yes.
And if you go deeper into that, you realize that the reason we're picking Nyeri is because of non-communicable diseases, the cancers and such. Kisumu because of communicable diseases. Isiolo because it's a pastoralist area, and Machakos because it's on the highway, so it's more prone to many accidents.
Yes.
So for you to make that decision, you need data. Okay. So for MedBook, being there for the last 7 years and having rolled out hospital management systems across the country, we can actually tell you the most prevalent disease probably in, let's say, Kisumu is malaria. Okay. So when government is rolling out universal healthcare, they need that data to know that when we are deploying medicine through KEMSA to Kisumu, we need to send more malaria drugs. Okay. When we want to build a cancer hospital, let's build in Nyeri because that is where the data is leading us to.
Yes.
So I'll always go back to the data. It's the data that will inform decisions. Okay. So when government now partners with private players, it is very important to go with a company that has the data to actually actualize all this.
Pretty much. All right, let's look at another area as well when it comes to UHC and anybody wants to peg on it, because it's something that we are saying let's roll it to the counties, and now we do know that health is a devolved function. Let's talk about the infrastructure for companies that are heavy on a data like yourselves. Do you think that these counties are ready for UHC in the sense that your company is heavy on data, so you have to have that enabling infrastructure? And let's talk about it in this sense. 50% of Kenyans, yes, they don't have smartphones, but we do have phones, even despite us saying that, well, the phone penetration in the market is, well, way past 100, depending on exactly how you look at it. So for this person in the county really wants to be on MedBook, and that is something now they'll get exposed to. Do you think that you are going to be forced to reinvent again your services so that you can encompass them who might want to be on board, but in one way or another, they are not really enabled to be on board?
Okay. So thank you for that. And that's very important in terms of basically accessibility for everyone. So remember, universal healthcare, one of the most critical things is that no one is being left behind. So all residents of a particular country have to have access to affordable healthcare.
Yes.
And what you're bringing out is that not everyone has a smartphone, which is correct, but at least the majority of the people in this country have phones. So we explore the idea of USSD. Okay. So as long as you have a phone, you'll be able to actually get access to a doctor. It doesn't have to be a smartphone.
Yes.
It just has to be a mobile device as well. Okay?
Yes.
So with that, the investments that you've done in terms of where our servers are, and now we are currently hosting on Amazon Web Servers, means that the coverage is across the country. So someone just needs a phone, not a smartphone, just a phone. And with that phone, they're able to interact in terms of sending a command and actually getting information in terms of healthcare. So even in terms of not only having access to a doctor, we employ so many things that someone can go and run a particular code and get being told that there's a health camp that is going to be in Isiolo on the 26th. So those are the information that is being sent to the community to tell them that now government will come closer to you.
Yes, pretty much. Now, since we're talking about that, then let's see exactly how somebody wants to get onboarded on MedBook. What do I need to do today? Should I want to start using your services?
iOS, Play Store. So there are two ways. Are you a doctor or are you a patient?
Yes.
So once you download the app, if you're a doctor, we just need your... so we are very heavy to ensure that we don't get quack doctors on the platform.
That's it.
So the Kenya Medical Practitioners and Dentists Council has a registration for all particular doctors in this particular country. So we just need your national identity card and your certificate for the board to show that you're in good standing.
Yes.
So once you go on the app, you are able to now set your own rate. And we made it so easy such that we give access to every patient. Now the doctor will go there and set their own rate and say that for my services I charge 5,000 or for my services I charge 2,000. So you as a patient, when you go to the app, you are able to choose which particular doctor do you want. So first of all, you'll be able to search for a doctor and you're able to get a doctor within, let's say, 3 kilometers.
Yes.
But within 3 kilometers, there are two doctors. One is charging 5,000 and other one is charging 1,000. So the liberty is up to you to choose the doctor that fits your bill. Okay. The other way that someone can be on board is that you have a clinic and you're looking for a hospital management system, and we're able to deploy hospital to be able to automate your facility all the way from registration to inpatient.
Sure.
For insurance companies, we have you have the claims management system to ensure that all these health facilities are able to claim back you as a patient, and you've gone to the hospital and used your card. The hospital is now able to claim back from the insurer and get paid.
Pretty much. Now, but I've got to ask you this question. Here's a direct one from a viewer who saw the whole interview being teased online. And they said, is it therefore possible that with services like MedBook, I mean, the biggest bottleneck for NHIF has been that, well, you have to select an outpatient facility, that every time you want to go to hospital, you just have to go to the one that you've selected, and that you can do it once or twice a year. So is it possible, since we have all this data about myself, where I've been, and exactly what I'm ailing from, is it possible, therefore, that your solution will bring us closer to walking into any hospital, but then at the end of the day, my data reflects that, well, I've been treated and they need to compensate the various facilities?
You just said perfectly.
Now, are we moving towards that direction?
We are actually moving. Some of the,
yes.
If you had asked me that question 2 or 3 years ago, I'd have said it's going to be hard.
Yes.
But personally, I love NHIF.
Yes.
The idea that the government has a national hospital insurance fund to cater for everyone,
yes,
that will be the avenue towards universal healthcare.
Yes.
So currently now we have around 20% of the public being covered by NHIF. But with the policies that the government are going to deploy, we can actually have 100% of the population to be covered.
Yes.
So one thing, if you are having a company that has data, we will be able to remove the inefficiencies. We'll be able to first also increase the coverage and also remove the wastage.
Yes.
Okay. So one of the reasons that NHIF will tell you to be able to choose one facility is that as I take you back 2 years ago, there were no mechanisms to ensure that Simba has chosen, let's say, Nairobi Hospital,
yes,
and has chosen MPSHA as well. It becomes easier to just have Simba in one particular facility because you don't have the mechanism.
Yes, yes.
Now with MedBook, we are able to automate all these health facilities and the NHIF on a single database. So it doesn't matter which particular hospital you choose. Even if you choose Hospital A and you go to Hospital B, all your data that was interacted in Hospital B can be accessed here.
Pretty much.
It makes it easier and also removes a lot of fraud that is prevalent in the healthcare industry.
Yes.
Because you cannot now impersonate. For example, on our claims management system, should you be at Hospital A at 8 a.m., you cannot be in another hospital, let's say 100 kilometers away,
yes,
trying to get medical services. The system will flag it off and say that there's no you could have traveled.
Yes.
Okay. Or you're a gentleman and you're going to claim for maternity, for example. So the system claims that. Or you are a healthy 25-year-old gentleman and suddenly the doctor is prescribing heart medicine. So the system checks and says there's no way you could be having heart problems at this early age.
And there's no history of that in the system,
Exactly,
isn't
there's
it?
no history for that.
Yes, pretty much. As we come close to the end of this conversation, because we only have 1 minute left, I gotta ask you though, I mean, you find yourself enshrined within the UHC, that you can't run away from it. In fact, it looks as if you're right within it. The bill is getting floated. We do expect developments from it. We've had public participation. The biggest challenge they're saying is that, well, do not expect anybody who's above 18 to afford that 6,000 in a year. That's the biggest challenge that they're saying. For me, what you said this morning, in a minute, what do you think is the biggest challenge to UHC?
The biggest challenge will be, personally, I feel there's a lot of wastage in the healthcare industry. And with a lot of wastage, there's a lot of inefficiency. So if we can cut down on the expired drugs the drugs that are being sent to counties that do not need those particular drugs.
Yes.
Or basically building a dispensary where in that particular area we'll have built basically even a cancer facility.
Yes.
For me, my biggest challenge will be we're not using data to the maximum. I'm a data guy. Before we develop anything in relation to healthcare, let's go back to the data. Let's involve the community health workers. Let's have everyone on board, ask them what they want. And with that, we'll be able to roll out this program perfectly. And it's possible.
And it's possible, isn't it? Pretty much. Thank you very much for coming.
Thank you as well.
Now, for those who want to get on boarded on that, it's quite easy. I'm actually I'm going to do that right now because it's the second time that I'm getting this conversation. It is pretty much MedBook services, isn't it?
On the app is MedBook Africa. If you want the HMIS,
yes,
you're able to call us we are on our website and we can actually come and automate your facility.
Pretty much. So get on boarded because that is exactly the next frontier, especially when you're moving into universal healthcare. My name is Simba Elijah Charles. Can I give you take a short break? But once we come back, I'll be asking you this question: the 16% VAT on cooking gas. Have you refilled your gas? Yeah, that is this month. How much did it cost? Was it necessary for the government to hit you like that? Have you gone for a loan? How much are you paying for it? Once we come back here on a Metropole Television. Good morning.